Hey, everybody, it's Kevin Henry. I am the host of the Dental Trade Alliance podcast, as well as the editor-in-chief for drbicuspid.com. Thank you so much for joining us today. I'm excited to have on Lauren Seno, who is the Chief Operating Officer of CHARM Economics. Hi, Lauren. How are you?
Hi, I'm doing great. Thanks for having me today.
Hey, thanks for being on. I appreciate it. I'm excited to talk about our topic today. But before we dive in, would you just let our audience know a little bit more about you?
Yeah, absolutely. So as Kevin said, I'm Lauren Seno. I'm the Chief Operating Officer with CHARM Economics. CHARM is a boutique healthcare economics research firm. Also, and a lot of my background is in doing survey research as one of the kind of qualitative components that we use to supplement some of the more quantitative research we do. And today I'm going to be talking about the survey that we did that was commissioned by the Dental Trade Alliance that took a better or kind of a closer look at utilization patterns for people with dental insurance.
And I feel like we've talked about access to care for so long for the general public. And I thought there were some really interesting findings in this survey that you did. So I'm going to turn it over to you. And obviously I'll ask a few questions along the way, but what are some of the high points do you want to make sure our audience knows?
Yeah. So kind of start at the very highest level, like what was the survey? What did we do? How did we do it? So we conducted a survey in May of this year, 2025. We polled about 1,000 adults in the US, all of whom had dental insurance. So we wanted to sort of really just focus in on that insured population and see, okay, well, you have insurance. What barriers still exist to utilizing that insurance to get the kind of care that you need to support optimal oral health? And generally speaking, the kind of, again, sort of three main objectives were we wanted to understand people's perceptions of their dental insurance coverage. We also wanted to get better understanding of the patterns of how they utilize that dental insurance for preventive care, for more advanced care, and then kind of, again, focus in on what the barriers are to accessing that dental care. What we found were really three kind of high-level themes. We had asked like 30-something questions. There's tons and tons of data, but to kind of make it bite-sized and accessible, the three big themes that we identified in the research was, one is there's really significant age-related disparities in dental benefit understanding. We sort of described this as like a U-shaped curve where people on the kind of lowest end of the age spectrum for our population, at least for this study, which was adults, that young population is 18 to 24. And then on the other end of the spectrum, older adults, 65 plus, patients or respondents in those two categories had the lowest levels of dental benefit understanding. So when we ask questions about, do you know your out-of-pocket maximum? Do you know your deductible? Even a more qualitative question that's like, how comfortable do you feel with understanding your dental benefits? They tended to end on sort of the lower end of the spectrum. 27% of young adults, 21% of older adults said that they had reported strong comprehension of their dental coverage, whereas 38%, a significantly higher number of adults ages 35 to 54 said that they had really strong understanding. So that was one big finding, is we kind of see this U-shaped curve of benefit understanding among, the lowest rates among the youngest population and the lowest rates among the kind of oldest population. The second is, yeah.
Let me just ask you something about that, if you don't mind, because I know a lot of people walk into the dental practice and expect them to be able to fill them in on the information rather than the other way around, which I know sometimes puts stress on that front office team and those insurance coordinators that are just coming into the industry as well.
Yeah, absolutely. And, I think everyone has different insurance. And even if you think you have, I say, oh, I've got Medicare. Well, Medicare means like 10, 20 different things now. When you have Medicare Advantage, you have different types of coverage. Same with the Medicaid population. And we see in those two populations, the youngest and the oldest, the highest levels of government coverage. And so that's Medicaid for the younger folks, Medicare for the older folks. And so, if a patient goes in and say, I have Medicare, what does that mean? The front office doesn't know necessarily what kind of Medicare that could be. They could be in a Medicaid plan that's a managed care organization, or they've got an MCO, and that's a little bit different than maybe a traditional Medicaid in their state. So I think there's just across the spectrum lack of information around what the benefits look like. And when folks have that lack of understanding, it leads to surprises, and those surprises can become significant.
And I'm sorry to interrupt, but please go ahead, and I'll probably ask a question after this one too. So just be prepared.
Please. Yeah, please do. I get tired of hearing my own voice sometimes talking about survey results. But actually, that's a good segue into the second finding, which is that surprise billing really does erode trust and can impact whether or not folks seek care in the future. So the survey, one of the questions we asked is, have you ever received a surprise bill? 30% said yes. And then when we probed that 30% and said, okay, well, what does that mean? We asked, does it impact your trust in your provider? I think 69% of them said yes. Does it impact your trust in your insurance? 72% said yes. And then importantly, 70% said it would deter me from seeking care in the future. And that sort of pattern of care avoidance becomes something significant, not just for the patients, because, that leads to poor oral health in the future, but also for the practices because they're losing patients. They get a surprise bill. It has nothing to do with the care that they received. It has everything to do with just the piece of paper they get at the end of the day. And that could impact their interest in wanting to come back.
Surprise billing feels like something that's been on the news quite a bit lately. I live in Colorado, and I know it's been a lot of discussion here in our state. And I know it's something that people are vehemently opposed to. And as you said, I often hear when they get that surprise bill, that bad taste in the mouth that it leaves afterwards. Is there a way for dental practices maybe to make sure that that doesn't happen as much as maybe was reported in your survey?
Yeah. And I think there's two flavors of surprise billing that we kind of get that we hear about right now. And I think the first flavor is the one that most people react negatively to, which is a government mandated surprise billing regulation. That's the one I think that people tend to have a reaction to. And then there's the second one, which is at the practice level, providing insight into what the price may be. I think when you're thinking about a market solution, what can practices do to facilitate it? It's kind of getting ahead of what might, right now, the surprise billing mandates that exist in medical care don't exist in dental care to the same extent. And so what can be done in the dental practices to get ahead of that? So, preventing those surprise by doing it because it's, what is good for the patients, what engages them, not because it's some sort of government mandate. And so I think it's sort of teasing out that difference and also just being proactive about making sure patients have the information they need so they aren't surprised when it comes to that.
And again, I think it goes back to we have so many new team members that are coming into dentistry. We need to make sure that their communication skills are up to date and that, they're ready to answer any questions there might be so that patient doesn't have a bad experience, shall we say, after the visit happens.
Yeah, exactly. And I think, and this is something that we can kind of get to towards the end, which is, what does this all mean? And I think one of these things is this is a great opportunity for technology innovation to facilitate a better result for practices. Are there things that can be developed or invested in that provides that price transparency, that it does kind of in the moment benefit checking, that can look and see, is this going to be covered by this person's insurance? Those kinds of tools and technologies that are supportive of getting to that result or that solution, which is patients have an understanding of what that bill might be.
Yeah. All right. Well, I'll let you get your third point.
Yeah. So our third finding was related to disparities in experiences of anxiety and specific barriers to receiving dental care between people who identified as women or who identified as male as our respondents. So we know that there's this kind of gender-based disparity between how folks are experiencing care in the dental setting. And, kind of to double click on that a little bit, anxiety, I think the rates of anxiety for women, and I'm going to look at my notes so I don't make up numbers here, is 50% of women say that they experience frequent anxiety when going into receive dental care versus 39% of men saying the same. And that's a statistically significant difference. It's also, I think both numbers are pretty high. One out of every two people, women that walk into a dental office are experiencing what they would consider frequent or intense anxiety. Same with, 4 out of 10 men are experiencing the same. And so I think this idea of anxiety as a barrier to care is one that really starts to bubble up. And then it also has this added dimension of kind of an unequal experience between men and women. And kind of, again, along those lines, we think about a psychological barrier, that's anxiety. We also think of, more like physical barriers. And, women more often report saying that they can't find times that meet their schedules, or they lack transportation to get to their appointments. And so there's kind of two dimensions of those barriers, and the psychological ones are important, but also some of the like kind of more physical or frictional barriers.
So I know we're doing this for the Dental Trade Alliance, which obviously is on the industry side of dentistry. So do we in the dental industry maybe need to do more to alleviate those fears? You talked about technology as a possibility. Are there things that we need to be looking toward on the technology side of things that can help alleviate fear, that maybe can be talking points for the dentists and dental team members out there?
Yeah, I think so. And I think that's, some of the conversations we've been having with DTA around like, what does this mean for our members specifically? It's great data. It's really good information. You could see how it can be applied in the clinical lens. Take a step back. How can it be kind of applied through the sort of like supplier lens, or, the industry that supports all of these dental practices? Yeah, kind of to your point, I think it's a big opportunity for innovation and investment in tools and technologies that can facilitate solutions in these areas. Kind of, what I said earlier about, are there things that we can do to facilitate a better understanding of what the prices may be or what the bill might be at the end of the day? What about tools, technologies that support kind of more calming experience in the dental office? I know, like when I go to see my dentist, they've got like TVs in the ceiling, and I can like sit there and bliss out to watching the Great British Baking Show. And that makes me feel better when I'm in the chair. But what are things like that can be invested in and kind of supplied to these practices to facilitate answering some of these questions? And I think at the end of the day, too, when patients aren't going in to their providers, whether they're avoiding it because they're anxious, or they're avoiding it because they have kind of a fear of a surprise bill, or they just can't get to the office because they don't have the transportation they need, or they can't meet the, bright hours. All of that kind of adds up to constrained practice revenue. In addition to obviously there being negative clinical impacts, especially downstream, it constrains practice revenue, and practice revenue constraints can have an impact on the market opportunity for all of these suppliers that support the practices themselves. And so it's not just a clinical problem. I think we have to look at it through the lens of it also being an economic problem and a market problem that is important for kind of everyone to rally around and make sure that patients are getting in to get the care that they need, both clinically and financially.
So what are the next steps in with the survey with Dental Trade Alliance and CHARM Economics?
Yeah. So, we're going to continue to be talking about this with DTA over the fall and, over the next couple of weeks and months about what these solutions look like. But I think it starts with understanding the data, understanding the pain points that the practices are experiencing, and what the patients are experiencing, and figuring out what are the solutions behind that. We think a lot about kind of innovation and technology. How can technology be used to solve these problems? And a lot of the suppliers and the folks in the ecosystem around the practices are the innovators. They are there because they developed a product that solves a problem. And so I think the next step is thinking, okay, these are the big problems that patients are experiencing, that practices are experiencing. How can we start to create more solutions around those specific problems?
Well, Lauren, I appreciate the insight into what could be a very fascinating survey here, and especially knowing what implementations may happen. Is there a way that people can learn more about CHARM Economics and maybe what you all do outside of this?
Yeah, absolutely. So you can always find us on LinkedIn, CHARM Economics. You can find me on LinkedIn, Lauren Seno. We also have a you can go to our website, charmeconomics.com. We are kind of an organization that is really committed to understanding, what are the economics behind the healthcare industry, whether that is medical care, dental care, and what does that mean for everyone involved in the ecosystem? Whether that is a venture capital firm or a policy organization, or somebody who has a product that wants to kind of commercialize it and sell it in the market, and they need economic evidence for it. That's really where we love working, and we are always interested in talking with more organizations that are interested in putting that together too.
Well, I'm looking forward to next steps with this survey. Thank you so much for the time. I really do appreciate it, Lauren.
Thank you, Kevin.
Absolutely. Thanks to all of you who've listened to this episode of the Dental Trade Alliance podcast. It's exciting to hear what's going on out there to help bring people into the dentist and make sure that they are not only comfortable while they're there, but afterwards as well. Until next time, it's Kevin Henry, the host of the Dental Trade Alliance podcast and editor-in-chief for Dr. Mike Husband, signing off, and as always, wishing you nothing but success ahead.